I would like to welcome Dr. Alok Goel. Dr. Alok is the office in charge in Homi Bhabha Cancer Hospital, Mullanpur, Punjab. He has done his MBBS, MD Medicine, DM from TMH Mumbai. He has done advanced training in molecular oncology and immunotherapy from Harvard Medical School, USA, and targeted therapy and personalized medicine from Johns Hopkins, USA. He has been awarded with Best Young Oncologist Award, Vienna, Austria 2017 and Accord Award for Clinical Research, Australia 2018, Member American and European Society of Medical Oncology.
Myths about cancers and Mythbuster. So this is very important because there are a lot of misconceptions in the society about cancer, and that leads to delayed presentations, and the outcomes of the disease are dismal when they are present in advanced stage of disease. Although we have now cures even in the advanced stage of disease, but the cure rates are much higher if we pick them at an earlier stage of disease. So just to give, I will skip this slide. We know that it's a very common problem. It's the second most common cause of death in developed countries, and in India it is at present third, but it is predicted that by 2050 it will be the second most common cause of death only after cardiovascular disease. So cancer is a big problem and we need to talk about it. So if we look at the global cancer incidence, Asia forms the majority of the cases. Sorry. So about half of the cases worldwide are from Asian or developing countries, and thus the need for awareness and is much more here. So if we look at these figures, there have been increase in the number of cases worldwide as well as in developing nations. So if we look at this, almost 14 million cases, new cancer cases are in developing world, and they are about 70% of the total global burden of cancer. So that is something to ponder, and we should know, we should bust these myths and misconceptions so that we can make people more aware. So with cancer comes a lot of thoughts. First is a disbelief that why I am being given the disease, why I have cancer. The patient panics. He feels that it's the end of the road and nothing can save me, and so he goes into depression and grief. Then there's always a burden, that financial burden, that the cancer treatments are very costly, and eventually I have to die. So why should I go for these cancer treatments? And therefore a lot of alternative treatments are taken, which lead to dismal outcomes, and the patient present in advanced stage when the symptoms are not controlled. So these are some of the things which hinder treatment, the myths, the social taboos, the negative concept of cancer, that it is incurable disease, a lot of fear which comes and misinformation which is there, and there are a lot of stigma and discrimination of the patient in the society. And we need to work on all of these to have patient come earlier to us. So we'll just quickly go to what are the myths which are there in the society. These I collected while I talk to the patients in my OPD. The first myth is that cancer is incurable and fatal. This has been discussed again and again in this forum, that now we have cure for cancers, and even in advanced stage we are now able to cure cancers. So we should not deny treatment to any patient based on the stage of disease. The most common second myth is that cancer can be contagious. So therefore the people discriminate a cancer patient and maintain a distance from them. So it is very important to know that cancer is not contagious. We should spread this thing, and staying with a cancer patient only spread love, doesn't spread cancer. So this should be totally bear in mind that it's not communicable. So there is also misconception that I am young, I have not done anything, why I have got cancer. So cancer is not a disease of wealthy or elderly. It can affect anybody, from a rich person to from a poor person, or to any person who is old or young. So it doesn't discriminate based on anything. So these are some of the things which we see commonly in the OPD. These are some of the photos we have taken. So patient come with these type of alternative treatment. They wear something. They say, the cat has crossed my path, therefore I have ill fate, and therefore I have developed cancer. And they wear these things around their ankle or in their toes to fear up, and that lead to delay in their presentation on the hospital, which have a dismal outcomes thing. So we should know, as already being discussed, that it's mostly genetic mutations or a defect in the cell replication which leads to tumor, and it has nothing to do with superstitions or the sins which have been done in the past. So we should advocate that thing. So these are some of the known risk factors for cancer, and these are modifiable, and this should be our most important stress should be on avoiding these things. So should we avoid tobacco? We should avoid alcohol. Reproductive factors. Some of the tumors like breast and uterus are more common in reproductive age groups. So that should be known. Some occupational exposures like silica, some radiation exposures can lead to higher risk of cancer. Unhealthy diet, metabolic syndrome, obesity, no exercises, and certain infection like HPV, which is now in news because of HPV vaccine, can cause cancer. And in 10 to 15% of patients, it's a family history of the genes, a defective gene which leads to cancer. So these are modifiable causes, and these are causes for cancer, and these should be taken care of, and we should advocate our patients to live a healthy life. Some next myth is that if you have family history of cancer, you will get it too. So this is not true. Only 5 to 10% of cancers are hereditary, and the risk of transmission, even if your family have a cancer, is around 10%. So not everybody who has a family history of cancer will get cancer. So they should have a regular screening. They should have a more robust screening, but that doesn't mean that everybody who has a family history of cancer should get depressed that I will get cancer. And we have now preventive measures and screening programs to help these patients pick up cancer in early stage. So another myth that there are no measures for reducing cancer risk. So as we have discussed, there are a lot of modifiable risk factors which we can work on from our side to decrease the risk of some of these cancer. This is also very, very common myth which leads to delay in investigation diagnosis, that biopsies will cause a spread in cancer. So the patient are scared of biopsies and they don't get biopsies done. So biopsies are effective diagnostic tool for detection of cancer, and avoiding biopsies only lead to delay in diagnosis, but they don't lead to a spread of cancer. Next is that every abnormal growth is cancer. This is only for a esteemed population, but we should not advertise it in the population, because then they will think that's a benign disease. But as a medical fraternity, we should know that every abnormal growth is not cancerous, and some of them can be benign. But for every growth, you have to meet your oncologist so that he can evaluate you and tell whether it's a malignant growth or not. Some of the patients came to me and say whether I use hair dyes and antiperspirant because of which I have cancer. So there is no definitive evidence that or concrete evidence that these can cause cancers, and you can use them in a moderation as any other thing. So some people think we have injuries in the past, देखो मैं गिरा था उस दिन में इस वजह से मुझे कैंसर हो गया. So cancers are not caused by injuries. Only thing is when you have an injury, you have pain, you go to doctor, and sometimes when you investigate, you find a cancer on a radiological investigation. So injuries don't get cancer; they just pick up the cancer because of the investigations. This is another myth which is there that sugar causes cancer. Sugar causes metabolic syndrome. It can increase the risk of diabetes, hypertension, but there is no direct link of causing cancer. Yet it can cause obesity, which can predispose to some cancer. So we should moderate sugar. We should have non-refined sugar. That is there. But leaving sugar will prevent cancer. That there is no evidence of that thing. So this was a very big thing 10, 15 years that I will have wheat grass juice and I can cure cancer. Some of my patients have left treatment thinking that wheat grass juice will cure cancer, and then they come back with a relapse of cancer. So there is a lot of scientific evidence now that which says that the main thing which is causes is antioxidant. It can have an antioxidant effect leading to improved digestion, some effect in common cold, some pain, but there is no cancer preventive or cancer curing properties in this. And this has been proven through various animal models as well as studies. So the patient can have it, but they should not stop their treatment. And yes, because they are eaten raw, so they can cause nausea and they have to be clean. Otherwise, some infection can occur in patients who are neutropenic. Some people think some prostate patient or some patient come and say, I with my positive attitude will cure cancer, no medicine will be required. So it is good to have a positive attitude, but to leave treatment or evidence-based treatment in view of positive attitude is not enough to cure cancer. And apart from positive attitude, treatment is required to cure them. This is also very, very common with that I am not a non-smoker. Why do I have a lung cancer? So yes, lung cancer is more prevalent among smokers, but it's not that a non-smoker cannot get lung cancer. So by fact, almost around 50% of lung cancers are there in non-smoker, and now we have found a reason that there is some genetic aberrations in some of the genes which we can target, which causes this cancer. So yes, passive smoking as well as other occupational exposures are a risk for lung cancers, and non-smoker can also get lung cancer. Some people say, I'm just having e-cigarettes, cigar, light cigarettes, I will not have cancers. So every form of tobacco smoking, whether it's cigarette or BD, cigar, e-cigarette, all have equal risks of cancer, and we should not promote or advise our patients to shift from one form of nicotine to other because the risk is same. Some patient came and told me that I read somewhere that caffeine causes breast cancer. I went back and looked the evidence. They no evidence that caffeine causes breast cancer. There's some research which is not proven that it can actually reduce the risk, but yes, they know causal relationship of caffeine with cancer. Some people think that small breasted women have less chance of getting breast cancers. No, even men, anybody can have breast cancer, and there is no relationship with the size of breast with breast cancer. Some people think that men are not liable to have breast cancer, but yes, 1% of men have breast cancers, and breast cancer can occur both in men and women. There is a myth that when you have breast cancer, you have to remove whole of the breast. But in early stage of disease, a breast conservative surgery where you are taking a lump out of the breast is as good in outcomes as mastectomy. And so a lot of young females and even elderly females can save their breast, and which can have a very positive effect on their psychosocial and physiological well-being, that they have morphologically they are not have a mastectomy done. So we can advise safely BCS breast conservative surgery to all of our patients who are eligible for it. Some of the patient think कि मैं treatment लूंगा तो उसके side effects are even worse than the disease itself. This is not true. We have more advanced treatment now in radiation surgery as well as chemotherapies with immunotherapy and target therapies coming on, where the side effects have decreased substantially and the outcomes have improved. So every patient should have a discussion with the oncologist and should not be written off even in stage 4 disease that he should not be cured because of the side effect of a treatment. So I ask all my patients to continue working when they are on treatment, and most of my patients keep on going for work when they are working, because that leads to a positive attitude that they are contributing to the society, they are useful, and that positive attitude gives them better outcomes in treatment. So we should advise they should take some precaution when going crowded places when they receive severe chemotherapy, but they can continue working and contribute to society in whatever form that helps in motivating them and keeping their confidence very, very high. This I will leave. So some cancers we can put on observation and we don't need to treat some of these cancers, and we can observe them. So cancer research is fruitless and we are only experimenting with patients. So this is not that. Cancer research is the best thing which can give us better treatments, and we should encourage our patients to take part in cancer research, because that's the best way they can explore a newer treatment at a lower cost or without any cost. So we should not, the patient if come to us and say that I will have experiment on me, you should explain to them that cancer research is very, very useful and they should take part in a well-explained cancer research, but they should understand the consequences and give their consent. Ma'am, if I am overshooting the time, you can ask me to stop, please. There are 1 or 2 more slides.
Sir, we have other speakers too, but
yes,
you
ma'am,
can...
I have just finished. So thank you. So these are some of the myths. I just want this platform to take down these myths and disseminate as much as possible, because the only way of preventing cancer is to pick them at an early stage. And if we can take care of these myths, we can pick them at an early stage, and we can definitely improve the survivals and outcome of these patients. Thanks a lot.